Welcome to our deep dive,
Mm.
into this fascinating world, I guess, of pituitary adenomas,
Okay.
specifically gonadotroph adenomas.
Yeah,
And, these are, I think, the most common type of pituitary macroadenoma,
they are.
but they can be really tricky to diagnose because they often don't cause any noticeable symptoms early on.
Right.
So it's like they're hiding in plain sight.
Yeah, they're often called clinically non-functioning
Yeah.
because they don't always produce like a clear hormonal signal.
Right.
The trouble is they can grow quite large
Uh-huh.
and begin to press on other structures in your brain,
Wow.
especially the optic nerves, which can affect your vision.
I see.
Yeah.
So it's really a race against time to catch them before
Yeah.
they cause serious problems.
Yeah, absolutely.
So understanding the management approach, I guess, is really important.
Yes.
So where do we even begin when it comes to treating these kind of stealthy adenomas?
Well, the primary goal is to relieve any symptoms you might be experiencing.
Yep.
And of course, to remove as much of the adenoma as possible to prevent it from growing back. And we also need to keep a close eye on your hormone levels because the adenoma can sometimes interfere with the normal function of your pituitary gland.
Okay, so it's like a two-pronged approach.
Yeah,
Tackle the adenoma itself and manage any hormonal imbalances that it might be causing.
exactly.
Now, you mentioned surgery earlier.
Yeah.
Why is that usually the first line of treatment?
Well, surgery specifically, a procedure called transphonoidal surgery,
Okay.
offers the fastest and most effective way to relieve pressure on your optic nerves and improve vision.
Mhm.
So imagine it like clearing a roadblock so traffic can flow smoothly again.
Right.
It also gives us the best chance of removing a significant portion of the adenoma.
And it sounds like it has a really good track record, too.
It does.
What kind of success rates are we talking about here?
Well, over 90% of patients see a reduction in adenoma size after surgery,
Wow.
and about 80% experience improved vision.
That's amazing.
It's a remarkably effective procedure.
But like any surgery, there are steps we need to take beforehand to prepare.
Okay, so it's not just a matter of, showing up at the hospital.
Right.
What does that pre-op prep involve?
Well, first, we need to be absolutely certain of the diagnosis.
Okay.
We want to confirm that it is indeed a gonadotroph adenoma and not some other type of lesion near the pituitary gland.
I see.
Blood tests play a crucial role here,
Oh.
especially tests that measure levels of FSH and alpha subunit,
Okay.
which can help us pinpoint the diagnosis.
So those blood tests are like our detectives gathering clues to solve the mystery.
Exactly. They help us confirm the diagnosis
Right.
and track your progress throughout treatment.
Gotcha.
Another crucial part of pre-op prep is making sure you have a highly experienced pituitary surgeon.
Makes sense.
Their expertise can make all the difference.
Absolutely. You definitely want someone who knows the terrain well
Yes, you do.
when it comes to a delicate procedure like this.
And finally, we need to identify and address any existing hormonal deficiencies before surgery.
Yes. That's crucial for a smooth surgery and recovery.
So it's like making sure the foundation is solid before we start building.
That's a great way to put it.
Okay, so now let's talk about the surgical procedure itself.
Okay.
Walk me through what actually happens during transphonoidal surgery.
Okay, so imagine your pituitary gland is like a walnut
Okay.
nestled deep within your skull.
Uh-huh.
The traditional way to access it was through an incision in your upper gum,
Okay.
giving surgeons a direct route to the pituitary gland.
Mm-hmm.
Nowadays, endoscopic techniques are becoming increasingly popular,
Oh.
allowing surgeons to use a tiny camera and instruments to reach the pituitary gland through your nasal passages.
Really?
This approach minimizes disruption to surrounding tissues.
It's amazing how surgical techniques are constantly evolving
Yeah,
to become less invasive.
it is.
But I imagine there's still a recovery period involved, right?
There is.
So what should people expect after the surgery?
Okay, so during and after surgery, we give patients hydrocortisone
Okay.
to help their body manage stress because the surgery can temporarily affect the pituitary gland's ability to produce cortisol,
Uh-huh.
a key hormone involved in stress response.
So it's like providing a little extra support during a vulnerable time.
Exactly.
Okay.
We also need to be on the lookout for two other conditions that can sometimes occur after pituitary surgery.
Okay.
Diabetes insipidus
Okay.
or DI and SIADH.
Okay.
So have you heard of diabetes?
I've heard of diabetes, yeah.
Like
What's diabetes insipidus?
So diabetes insipidus occurs when your body can't properly regulate fluids,
Okay.
leading to excessive thirst and urination.
Right.
SIADH, on the other hand, is when your body retains too much water,
I see.
which can affect your sodium levels.
Okay.
We carefully monitor fluid intake and output sodium levels and urine concentration to catch these issues early on
Okay.
if they arise.
So both conditions involve fluid balance,
Right.
but in opposite ways.
Right.
Sounds like post-op monitoring is crucial.
It is.
Yeah.
And the good news is that DI is usually temporary
Okay.
and can be treated with medication.
That's good.
SIADH is less common
Okay.
and typically managed by restricting fluids.
Got it. That's reassuring to know.
Good.
So what happens after that initial recovery phase?
Okay.
When do you typically see patients for a follow-up?
We usually schedule a follow-up appointment about 4 to 6 weeks after surgery.
Okay.
This is like a progress report to see how you're healing and how well your body is adjusting.
Right.
We'll assess the amount of residual adenoma, if any,
Okay.
check your vision, and do a comprehensive hormonal evaluation
Okay.
to ensure everything is functioning as it should be.
It's like making sure all systems are back online
Exactly.
after a major reboot.
Yeah.
So we'll be checking your thyroid, adrenal, and sex hormone levels.
Yes.
Basically making sure your hormonal orchestra is in tune
Yes.
and playing harmoniously.
Yes. Very good.
Now, shifting gears a bit,
Yeah.
let's talk about the long-term outlook for someone with a gonadotroph adenoma.
Okay.
What can they expect down the road?
Well, while surgery is often successful in reducing adenoma size, complete removal isn't always possible.
Right?
So there is a chance it could grow back,
Okay.
especially if some residual tissue remains.
So it's like those pesky weeds that keep popping up in the garden.
Exactly.
You get rid of them and then they come back.
They do.
So what do you do?
Well, don't worry. We have other tools in our arsenal.
Okay.
If the adenoma returns, radiation therapy can be used to target any remaining cells and prevent regrowth.
Radiation therapy, that sounds intense.
It is a powerful tool, but it's usually not our first choice for initial treatment
Okay.
because it works more slowly than surgery.
Got it.
It's more like a long-term strategy to keep things under control.
Okay, so surgery first and then radiation therapy if needed.
Exactly.
What about medications? Are there any drugs that can shrink these adenomas?
That's a great question, and it's an area of active research. Scientists are constantly searching for effective medications to shrink gonadotroph adenomas, similar to those used for other types of pituitary adenomas.
Right.
Think of it like trying to find the Achilles heel of these adenomas.
Okay, so the search for a magic bullet medication is still ongoing.
It is.
But it sounds like surgery remains the most effective weapon in our arsenal for now.
That's right.
But even with successful treatment life, with a gonadotroph adenoma often involves a long-term commitment to monitoring and management.
It does.
So what does that typically look like?
Regular checkups are essential at least every 6 to 12 months initially.
Okay.
Think of it like routine maintenance
Right.
to keep things running smoothly.
Okay.
We'll monitor for any signs of regrowth and adjust hormonal replacement therapies as needed.
So it's all about staying vigilant and proactive about your health.
Absolutely.
Now, it's also important to remember that living with a gonadotroph adenoma can have an impact on your quality of life.
It can.
So what are some of the common challenges that people face?
Well, fatigue and daytime sleepiness are common complaints, often linked to underlying hormonal deficiencies.
So managing those hormonal deficiencies is key to feeling your best.
Exactly. Hormonal replacement therapies can make a world of difference.
This has been a fascinating deep dive.
It has.
We've learned that gonadotroph adenomas can be tricky,
Yes.
but treatable.
Yes.
Early detection and proper management are key to preventing complications.
Absolutely.
Surgery is often the go-to treatment, with radiation therapy and medications playing a role as needed.
For sure.
But before we wrap up this part of our deep dive, I'd like to get your perspective on something.
Yeah.
Given the potential for regrowth
Right.
and the long-term implications of treatment, what factors would you consider most important in making decisions about your care?
That's a really important question, and
Yeah.
one that each individual needs to consider carefully with their healthcare team.
Sure.
There's no one-size-fits-all answer.
Right.
For me, understanding the risks and benefits of each treatment option would be crucial.
Makes sense. I'd also want to factor in my overall health, my lifestyle,
Right.
and my personal values.
That's a great point. It's a personal decision that should be made with the guidance of a trusted medical professional.
Absolutely.
Now, for our listeners who are eager to learn more about the specifics of treatment options, stay tuned for part 2 of our deep dive into gonadotroph adenomas, where we'll delve deeper into radiation therapy.
We'll be back soon.
We will.
See you then. Welcome back to our deep dive into gonadotroph adenomas.
Yeah, we've covered a lot of ground already, exploring the nature of these adenomas.
We have.
And why early detection is so crucial.
Right.
Now let's delve deeper into one of the treatment options we touched on earlier.
Okay.
radiation therapy.
Yes, radiation therapy can be a valuable tool, especially if surgery isn't able to remove all of the adenoma
Oh, cool.
or if it starts to grow back after surgery.
I see.
Think of it as a way to target any remaining cells and prevent them from multiplying.
You mentioned earlier that there are different types of radiation therapy. Right.
Can you explain the differences and why one might be chosen over another?
Sure. So there are two main approaches:
Okay.
conventional radiation therapy
Okay.
and stereotactic radiation.
Okay.
Conventional radiation therapy is like casting a wider net.
Okay.
It delivers radiation to a larger area surrounding the adenoma,
Mm-hmm.
which helps ensure we target all the adenoma cells,
Right.
even those hiding in hard-to-reach places.
So it's a bit like using a floodlight to illuminate a wide area,
Exactly.
making sure we don't miss anything.
Right.
But this wider approach also means that some healthy tissue surrounding the adenoma might be exposed to radiation.
That's true.
So there's a trade-off between making sure we get all the adenoma cells
Yeah.
and minimizing the impact on surrounding tissue.
Exactly.
And that's where stereotactic radiation comes in.
Right.
It's much more precise,
Yes.
like using a laser beam instead of a floodlight.
Exactly.
It allows us to target the adenoma very specifically, minimizing damage to healthy tissues. So it's all about finding the right balance
Yeah,
between effectiveness and minimizing potential side effects.
for sure.
Now, I know that no medical procedure is without risks.
Right?
What are some potential side effects of radiation therapy?
Okay, well, with conventional radiation therapy, you might experience some side effects during the treatment period,
Okay.
such as fatigue, nausea, or changes in taste and smell.
Wow.
Some people even experience hair loss at the radiation site.
I see.
But the good news is that most of these side effects are temporary
Okay.
and tend to go away within a few months after treatment is finished.
That's reassuring to know.
It is.
But what about long-term side effects?
Okay.
Are there any concerns there?
Well, one of the long-term complications we watch for is hypopituitarism,
Okay.
which is when your pituitary gland doesn't produce enough hormones.
So even though we're targeting the adenoma,
Right.
there's still a risk that the radiation could affect the healthy part of the pituitary gland.
That's
And the tricky part is that these hormonal deficiencies might not show up right away.
right. They can develop gradually over time, even years after radiation therapy.
So it's essential to be aware of these potential long-term effects and continue monitoring your hormone levels even after treatment is complete.
You got it.
And while rare, there is also a slight risk of more serious neurological complications,
Yes.
such as optic neuropathy, which can affect your vision,
Right.
or in very rare cases, even the development of secondary brain tumors.
Yes.
Wow, those are some serious risks to consider.
They are.
It sounds like radiation therapy is a powerful tool,
It is.
but it's not a decision to be made lightly.
That's right. That's why it's so important to have a thorough discussion with your doctor about the potential benefits and risks of radiation therapy before making the decision.
Now, what about stereotactic radiation?
Okay.
Does it carry the same risks?
Well, the research on stereotactic radiation for Gonadotroph adenomas is still relatively new. But so far, it seems like the side effects are similar to those of conventional radiation therapy.
Okay,
However, because it's more targeted,
right.
there's hope that it might lead to fewer long-term complications.
So it's like we're refining our techniques to be more precise
Exactly.
and hopefully minimize any unintended consequences.
Yeah, it's an area of ongoing research, and we're constantly learning more.
Now, you mentioned earlier that there isn't a consistently effective medication
Right.
to shrink gonadotroph adenomas yet,
Yeah.
but research is ongoing.
It is.
What are scientists exploring in this area?
Okay, well, one promising avenue of research involves dopamine agonists.
Okay.
These medications have been incredibly successful in treating prolactinomas,
Yeah.
another type of pituitary adenoma.
I see.
So the idea is to see if these same medications might work for gonadotroph adenomas as well.
So they're hoping that what works for one
Yeah.
not work for the other.
Right.
Right.
Precisely, there have been some small studies suggesting that dopamine agonists might have a modest effect on gonadotroph adenoma size,
Okay.
but more research is needed to confirm these findings.
It makes sense to explore medications that have already proven effective for similar conditions.
Right.
What other approaches are being investigated?
Another area of research involves somatostatin analogs.
Okay.
These medications mimic the effects of somatostatin,
Great.
a hormone that helps regulate various bodily functions.
And how do these somatostatin analogs work
Okay.
in the context of gonadotroph adenomas?
Well, some gonadotroph adenomas have receptors for somatostatin on their cell surfaces.
Uh-huh.
Think of receptors as tiny docking stations
Okay.
that allow hormones and other molecules to bind to cells
Right.
and exert their effects.
So it's like finding the right key to fit the lock on the adenoma cell.
That's a great analogy.
It's got to fit just right.
Right. The idea is that somatostatin analogs might be able to bind to these receptors
Okay.
and somehow inhibit adenoma growth or hormone production.
Gotcha.
There have been a few small studies with mixed results so far,
Okay.
but again, more research is needed to determine if this is a viable treatment option.
It sounds like scientists are taking a multi-pronged approach.
Right.
Exploring different drug classes to see what might work.
Exactly.
Now, I want to shift gears a bit and talk about a situation that's becoming increasingly common.
Okay.
The incidental discovery of Gonadotroph adenomas.
Ah, yes. Those silent adenomas that haven't caused any noticeable symptoms yet?
Exactly. With the increasing use of brain imaging,
Right.
we're detecting more and more pituitary adenomas, often by chance during scans, for unrelated reasons.
Yeah.
What happens in these cases when someone is found to have Gonadotroph adenoma,
Right.
but they're not experiencing any symptoms?
Yeah.
Is treatment always necessary?
That's a great question, and it's one that we grapple with frequently in clinical practice. It's
Yeah.
a delicate balancing act. We need to weigh the potential risks of treatment against the potential risks of doing nothing.
So it's like finding a small crack in the foundation of a building.
Okay.
It might not be a big deal now,
Right.
but it has the potential to become a problem later on.
That's a good analogy.
So you've got to watch it.
Yeah, and that's the challenge with these asymptomatic adenomas.
Right.
If the adenoma is small
Uh-huh.
and not pressing on any critical structures,
Okay.
we might recommend a watch and wait approach.
Okay.
This involves regular monitoring with MRI scans to check for any changes in size or growth.
So it's like keeping an eye on that crack in the foundation.
Exactly.
To see if it's getting bigger.
Right.
If it is, we need to call somebody.
We do, and if the adenoma does start to grow or cause problems,
Okay.
we can then intervene with surgery or radiation therapy.
So it's all about personalized decision-making,
Yes.
weighing the risks and benefits, and choosing the path that feels right for you
Yeah.
with the guidance of your doctor.
Absolutely, and it's important to remember that even if we opt for a watch and wait approach, we'll still want to monitor your hormone levels regularly.
Right, because even a small adenoma
Yeah.
can sometimes interfere with the pituitary gland's ability to produce hormones properly.
Exactly. So those regular hormonal evaluations are a crucial part of the management plan,
Right.
even in cases where the adenoma isn't causing any noticeable symptoms.
Well, I think we've covered a lot of ground in this part of our deep dive,
I think so.
exploring the nuances of radiation therapy,
Yeah.
the ongoing search for effective medications, and the complexities of managing asymptomatic adenomas.
For sure.
Really interesting stuff.
It is.
And in our final part, we'll shift our focus to the long-term outlook for people with gonadotroph adenomas,
Okay.
addressing those questions about what life looks like beyond the initial diagnosis and treatment phase.
Sounds good.
Welcome back to the final part of our deep dive into gonadotroph adenomas.
Yeah.
We've, covered a lot of ground so far.
We have.
From the initial diagnosis and the various treatment options
Right.
to, the complexities of managing those adenomas that don't cause any noticeable symptoms.
Yeah. It's been quite a journey
It has been.
through the pituitary gland.
Now, as we wrap up this deep dive,
So,
I think it's important to kind of shift our focus to the bigger picture.
yeah.
What does the long-term outlook look like for someone living with a gonadotroph adenoma?
Well, the good news is
Okay.
that with proper management, most people with gonadotroph adenomas can live long and healthy lives.
That's great to hear.
Yeah. But I imagine there are still challenges and things to be mindful of.
Yeah, absolutely. One of the key things to keep in mind is that there's always a chance the adenoma could grow back,
Oh,
especially if it wasn't completely removed during surgery.
okay.
That's why those regular checkups and MRI scans we talked about earlier are so important. Think of them as your early warning system, helping us catch any potential issues before they become major problems. So it's about maintaining that vigilance and not letting our guard down even when things seem stable.
Exactly.
We've talked a lot about the physical aspects of gonadotroph adenomas,
Yes.
the tumor itself,
Yeah.
the treatments,
Mm-hmm.
the potential complications.
Yeah.
But I'm also curious about the impact on mental and emotional well-being.
Okay.
How does living with this condition, affect your overall quality of life?
That's an important aspect that often gets overlooked.
Right.
Living with any chronic condition, especially one that affects the brain and hormones, can certainly take a toll on your mental and emotional health.
I can imagine.
Yeah.
Dealing with fatigue, hormonal imbalances, and the uncertainty of the future can be quite a burden.
It can be, and we also have to consider the potential impact on relationships work and your overall sense of self.
Right. It's not just about treating the physical symptoms, but also addressing the emotional and psychological aspects of the condition.
Absolutely. It's a holistic approach that acknowledges the interconnectedness of your physical and emotional well-being.
Now, if you could offer some words of advice to someone who's just been diagnosed with a gonadotroph adenoma, what would you tell them?
Okay.
What are the key takeaways they should remember as they embark on this journey?
First and foremost, I'd say don't panic.
Okay.
Gonadotroph adenomas are often slow-growing and manageable. Take some time to learn as much as you can about the condition.
Okay.
Ask questions and find a healthcare team you trust and feel comfortable with.
Become an informed and empowered patient, an active participant in your own healthcare.
Exactly. And remember, you're not alone.
Yeah.
There are support groups, online communities, and healthcare professionals who can guide you and provide the support you need along the way.
This deep dive has been incredibly informative, shedding light on a condition that many people may not even be aware of.
It has.
As we wrap up, what's one final thought you'd like to leave our listeners with as they continue their journey of learning and discovery?
I think it's important to remember that each individual's experience with a gonadotroph adenoma is unique. There's no one-size-fits-all approach to treatment.
Right.
The decisions you make should be personalized, taking into account your individual needs, preferences, and goals.
So it's a collaborative process between you and your healthcare team, finding the path that feels right for you.
Exactly. And as research continues, we're learning more all the time, and hopefully this will lead to even more effective and less invasive treatment options in the future.
That's encouraging.
It is.
So stay curious, stay informed, and be an active advocate for your health.
Couldn't have said it better myself.
We've covered a lot of ground today, from the initial diagnosis to the long-term outlook, exploring the complexities and the hope that surrounds gonadotroph adenomas.
Remember, knowledge is power. The more you understand about this condition, the better equipped you'll be to navigate the challenges and make informed decisions about your care. Thanks for joining us on this deep dive.
It's been a pleasure. Until next time, keep exploring.